Hi, I'm Isabella Galichia.
And I'm Dr. Jody Galichia.
And in today's video, we're going to be talking about high cholesterol.
High cholesterol is common. Cholesterol is a fatty substance that builds up inside our body, usually in blood vessels. It can occur elsewhere in the body. But that buildup of this fatty substance often then leads to atherosclerosis. Atherosclerosis, buildup of plaque, that can lead to heart attack, damage to vessels, and damage to those organs supplied by those blood vessels. So, it's important that we keep our cholesterol down. Now, how? Well, first of all, we talk about good cholesterol versus bad cholesterol, because if you have a high HDL, that's a good thing, and it protects you from all these things that happen, like atherosclerosis and buildup of plaque. A bad cholesterol that's high accelerates all of these pathologic processes and puts you at risk. So you got to know, what kind of cholesterol do I have? And then what can I do about it? And how did I get there? Did I gain too much weight? Is this something that is familial? Or is it just related to my now reaching age 60 or something like that? So you have to know why. And certainly the buildup of cholesterol within our arteries is a dangerous situation, and one which is a growing problem in the world today.
That's so good to know. So if I start to develop high cholesterol, what are some of the questions that I should ask my doctor?
Well, I think first of all, is it the good cholesterol or the bad cholesterol? The doctor's going to be so happy if your HDL is high. He's going to be so sad if it's your bad cholesterol. But there are variations here. You might have a minor elevation of your LDL cholesterol, in which case maybe diet and exercise would get you back to normal. And follow up. You can't just go in and say, well, my cholesterol was high, see you next year or in a couple of years. This needs more careful follow-up. Does exercise make it better generally, even if the cholesterol is high? The answer to that is true. Are there foods that I should avoid? Like, should you eat fatty foods? No. Are fruits and vegetables helpful in your diet in lowering your cholesterol and actually preventing the high cholesterol? What are the side effects I should look for? Well, for most people, it's kind of a silent killer. There are no real side effects. You don't know that you have a high cholesterol until something goes wrong or until you get checked. And therefore, I recommend that everyone who is an adult over the age of 35 get checked once a year for their cholesterol, for sure. And if there's a family history of a high cholesterol, should be done more frequently. Statins, those are great drugs for treating a high cholesterol. They work well. Their side effect profile is tolerable. There now are new drugs which can be given as injections that are phenomenal. And I've seen bad cholesterol levels fall from like 160 to 40. And that is an amazing change, and I think provides an amazing protection to that individual. And then, people always say, well, what can I do to raise my good cholesterol? Because it is a ratio that we're talking about. And exercise helps, weight loss helps. Maybe a glass of wine every day or every other day might help raise your good cholesterol. A lot of people like to hear that. A little glass of wine a day might be good for you. And I think the other thing that people ask about is, I've got a high cholesterol. What other risks do I have for having a heart attack or vascular disease in general? So, it may be very important for you to know what those other risk factors are. Do you have high blood pressure? Do you have diabetes? But very, very importantly, the question would be, what can I do to get this back to normal? And what can I do to keep it down? And how often do I need to be followed up?
Thank you so much for that overview. And thank you for watching, and be sure to visit ourhealthcommunity.com to learn more about high cholesterol.